Okay, we're going to talk about sick day management in type 1 diabetes. This is Dr. Prakash. I'm talking about sick day management in type 1 diabetes in children. So, if your child has type 1 diabetes, one of the dreaded thing is when will the child go to the hospital next time? And the good news is, if we are on top of it, a child when diagnosed will be the only time the child is in the hospital and never again should be going to the hospital. For that, we have to keep certain things as a rule on a consistent basis. Number one, at least once a week for 5 minutes, you have to look into what happened the previous week and what's the plan for next week. That will prevent a lot of your problems. But if an actual sick day happens, the child is not well, what are the things you have to do? Number one, talk to your regular primary care doctor, the pediatrician. The child might have a cold, cough, ear infections, might need an antibiotic, may need to be seen. It could be an appendicitis, it could be a urinary tract infection. So talk to your regular doctor to take care of the basic problem, which you would do irrespective of the child having type 1 diabetes or not. Then watch whether the child is able to drink fluids. The child is not drinking fluids. You need to make sure the child is hydrated. Keep some Pedialyte popsicles and regular popsicles and sugar-free popsicles at home. If the child is eating but not drinking, then you do sugar-free popsicles. If the child is not eating and not drinking, then you do Pedialyte popsicles or regular popsicles, because you want to give some calories. Why do we need to give calories? Then you can give insulin to the child, right? You need insulin for avoiding diabetic ketoacidosis. So you need to keep the blood sugars higher enough to take care of it. But if the blood sugar is very high for whatever reason, some problem happens, there is a site malfunction, or child forgets to give the shot, what happens? The child can go into ketoacidosis. So if you recognize insulin has been missed because the pump failed or the child forgot to give the insulin, the first thing to make sure is give a shot of short-acting insulin and then watch for the blood sugars to come down. If the blood sugars are not coming down, check for urine ketones at the same time. If there are ketones, you have to keep the child hydrated. You will also find if there is ketones, there is some amount of insulin resistance. So you have to give a little bit more insulin than usual. So instead of doing one time, you need to do 1.5 times or 2 times the dose of your short-acting insulin. If nothing is working and the child continues to throw up, don't keep waiting, don't keep paging the doctor, go to the emergency room. The earlier you go, you can avoid hospitalization. All might be needed is getting some IV fluid, getting some insulin to bring the things down. But the most important thing to avoid in sick day management is avoid being unprepared. Thank you. Bye-bye.